Hi, Dr. Lisa Vuich here, Renew MediSpa in Derry, New Hampshire. In this video, we'll talk about collagen loss, the effects of collagen loss, especially on the face and neck, what you can do to protect your collagen and also build back new collagen. And I'm going to tell you in detail about a new device, a new procedure we have at Renew called Sofwave, which can restore lost collagen without downtime.
Sofwave is a multi-award-winning device. In fact, probably the device with the most awards that I've ever brought into Renew. It's been proven to deliver remarkable results with even a single session and with no downtime. And I'm going to show you in this video how that's accomplished and how it compares to your other options. Sofwave has numerous FDA approvals or clearances, and again, more approvals right out of the gate than any other device we have. And this is no easy feat. This means they had to present the clinical studies, present the evidence to the FDA of not just safety, but also clinical result, and it had to be significant. Not just photos of improvement, but actual measures of the degree of smoothing, how many millimeters of lifting, etc. And those effects are listed here. It's been shown to improve the appearance of fine lines and wrinkles in the skin, proven to lift the brow, lift sagging skin in the neck and under chin region, and even improve the appearance of acne scars and of cellulite through its skin tightening effects. And this is the man we have to thank for this technology. If you're in the aesthetic field, you absolutely know this man's name and many of the aesthetic device companies he founded, such as Lumenis and Syneron Candela. He's a physicist who has co-founded and invested in over 20 companies, has hundreds of international patents, and has authored, of course, numerous papers and clinical studies. He's actually the inventor of IPL technology, which is one of the first energy-based aesthetic treatments ever created. That stands for intense pulse light, commonly referred to as a photofacial. So if you've ever had a photofacial, this is the man who created that. So thank you, Dr. Eckhouse, once again for bringing us this latest technology. Now, as you likely know, over time, our faces and our bodies age, in part as a result of the loss of collagen and elastin and hyaluronic acid in the skin. The rate of collagen loss depends on a number of factors, but on average, it's about 2.1% per year for an adult. Collagen loss begins, around the age of 20, and when you're younger, maybe it's more like the 1% per year, but as you get older, you lose more per year, closer to the 2.1%. And even more if you don't use sun protection or you smoke. Also, fair-skinned individuals lose it faster than darker-skinned individuals. Now, collagen is the most abundant protein in the body. It's our main structural protein of our tissues, and it's produced by cells called fibroblasts. If you cut yourself, these cells and others responsible for repair will jump in and create the collagen needed to repair the injury. The problem is, no injury, no repair, and so our collagen tank gets depleted over time. And why don't we like this in general? Well, people who come to the MediSpa will often say they don't love their wrinkles and their loose skin because they feel it makes them look worn out or tired. They may have people asking them if they're sad or mad when in fact that doesn't match their mood at all. They feel like they look older. They feel like they're perceived as less vibrant, less energetic. They may feel self-conscious about the lines of wrinkles. They may feel less confident, about their appearance in general, even less attractive. And in the workforce, they can be discriminated against in a variety of subtle and not so subtle ways, like getting passed over for a promotion, or if they're interviewing for a job, they'll often tell us they feel like their apparent age is a factor in why they might not be getting the position they want. And lastly, they may not love looking in the mirror and seeing the face of their mother, father, grandparent. They basically say, I don't want to look like that just yet. Now, topical collagen, unfortunately, does not work. Many people, understandably, will try something topical, but here's the thing. Collagen is a protein, and the protein molecules are way too big to penetrate the skin. Even if you disrupt the surface of the skin, such as with microneedling, the collagen is not getting through into the dermis. You're not getting it in there. Even if you chop it up, you're not getting it in there. It would be like trying to fit a Ford F-150 through a rabbit hole. Now, I'm not saying it does nothing, and I would include oral collagen, in the mix, supplements here as well. These things probably help mostly through hydration, with trapping water internally or on the surface of the skin. And if our skin is better hydrated, if it's plumped up with a little more water, this is going to have some effect on the appearance of fine lines and wrinkles. But it's generally not the look that you want. It's not enough. So that's not the same as restoring lost collagen. And absolutely, positively, I don't care what words they put on the label, nothing topical is going to lift at all. So what does work? Well, as I said earlier, if you want the fibroblasts to make collagen, you need to give them an injury to work on. They know how to do their job, they just need sufficient motivation. And so all of the devices we have in aesthetics that are designed to restore lost collagen simply differ in how they create the microinjury and how much microinjury they create per treatment. In the case of microneedling, it's the piercing of the skin with the tiny needles that causes the injury. But microneedling alone is a fairly mild injury, and so the amount of collagen produced per procedure is on the smaller side. And so this is why we tell microneedling clients they should expect to do a series of 3 or 6 or even more, and plan to do it even every 3 months to maintain their results. Now you can increase the injury further by adding heat, but you have to do so in a way that doesn't deliver heat to the surface layers of the skin where it can cause a burn. So many of these devices deliver heat only at the tips of microneedles, and I've listed several of those devices here. In fact, Profound RF was the first radiofrequency microneedling device I brought into Renew, and it worked well, but the handpiece is fairly large, and thus it was difficult to work in delicate areas like above the upper lip or below the brow, and we couldn't treat those areas, and we couldn't even treat the forehead, actually, effectively with Profound. So then we brought in a device called Lutronic Genius, and this is a popular one. We use it in a service called Total Skin. This one has a smaller handpiece, so we could use it in those delicate areas, so that's great, and it has less downtime than the Profound. But now you need to do 3 or sometimes even more sessions to get the results you want, even though we've added the heat. Then we brought in Agnes RF, which again has a small handpiece option, but Agnes RF does something neither of the previous ones do. It has actually special needles that we can use to selectively destroy fat cells. So in someone who has a double chin fat pad, or a heavy jowl fat pad, or bulging under eye fat pad, Agnes is uniquely powerful in its ability to do that on the face, to selectively remove excess fat cells, and we use it for that quite a bit. And finally, I list Morpheus 8 here. This actually is one we don't have, but it's getting a lot of media attention in particular since they came out with a body handpiece that's showing some results there. The next type of collagen induction therapy utilizes ultrasound. Microneedling with heat, as I mentioned, is effective, but it has more downtime than regular microneedling alone. And how much downtime really depends on the device, the settings, the strength of the treatment, and the area you're treating. Ultrasound, on the other hand, is unique in its ability to deliver heat without downtime. You may have had an ultrasound for medical reasons in the past, and in those instances, the ultrasound energy was not focused. The energy was delivered diffusely and in a manner to allow the medical professional to visualize structures or blood flow in the body. In aesthetic devices, though, that energy is deliberately focused in order to generate heat, and it's focused in such a way as to skip over the surface skin layer entirely, but still deliver high heat to the deeper skin to generate the injury there that will kick those fibroblasts into action. The first device to do this for us was Ultherapy, which was FDA approved in 2009, and at Renew we had it from about 2012, and we did thousands of treatments with that device. It works. I always felt, though, it did a better job tightening than it did smoothing, to be honest, and it hurt like hell, to be sure. I had it done myself more than once, so I know. Unfortunately, with Ultherapy, numbing cream didn't work, so we'd use medication and Pronox and such trying to get people through it. But now enter Sofwave, which is also a microfocused ultrasound device, but there are major differences here that make this a vast improvement over the older technology. And so we have replaced Ultherapy entirely with Sofwave. Sofwave came out in 2017 in Israel and was released in the USA in 2019. The other thing unique about Sofwave is that there is built-in cooling, which enhances the comfort for the client and protects the surface of the skin from the heat. The pattern of the energy delivery, as I'll show you in a moment, is entirely different with Sofwave than it was with Ultherapy, and it also delivers more energy per treatment and thus stimulates more collagen production. And fortunately, topical numbing cream does help quite a bit with the feeling of a Sofwave treatment. And finally, laser can also be used for collagen induction therapy, laser skin resurfacing. Laser entirely basically vaporizes columns of tissue in the skin, which then get replaced during the healing process with new skin cells and new collagen. But laser cannot skip the surface of the skin. Laser energy just burns right through, so to speak, to whatever depth you're treating. And in general, while you can get some tightening with laser skin resurfacing, I would say, again, it does a better job at smoothing than tightening, and at the expense of generally significant downtime. But, this is a Smart Skin CO2 laser client of ours who has a lovely result here even as early as 2 months. I'm still healing some, but she absolutely had a couple of weeks of downtime, with the first 5 days being the most significant. She also, just full disclosure, had some Daxify tox and some Sculptra as well, which is a biostimulatory filler to give her a little volume back in her cheeks. Now, she would tell you she'd happily do the laser again, but it is no cakewalk. And the bottom line is many of our clients who aren't retired or working from home simply can't afford that kind of downtime. So in summary, as shown in the video here, you see Sofwave with the contact cooling, creating these 7 unique cylindrical shaped thermal injury zones. So that's a lot of micro injury, but delivered very safely, compared to ablative laser, which has to burn right through. Radiofrequency microneedling with the heat just at the tips of the needle, so less injury overall. HIFU, which is the older therapy, more pinpoint heat, and again, Sofwave, broader heat treatment, much more micro injury, and therefore more result. So let's look at some results. Here you see 2 examples of necks treated with Sofwave. Very impressive improvement, very long lasting, and amazing, really, for something non-invasive with no downtime. And here, 2 examples, full face and neck on the left, clearly took at least 12 years off of her face and neck. The neck result is phenomenal. I'm sure she was thrilled. And on the right, as you see, improvement in that marionette region, that region below the corners of the mouth. That would be someone I'd say, hey, are you happy with where you are? Or maybe you want to do a second treatment. It's really going to be up to you how much tightening you want to achieve. And in the next set of photos, you can see, again, very impressive results for quite heavy lids. These clients would certainly be people who could consider the surgical option, but on the other hand, they might not have the interest in surgery or the downtime needed for surgical correction. So again, very nice results on the one on the right at 4 months post-treatment. So it's great to be able to deliver this kind of tightening with something non-invasive. And here again, in the next slide, on the left, beautiful, better definition in the jawline, certainly improvement in tightening and smoothing of the neck. And as you see on the right, even men and clients in an older age group can certainly look much more refreshed. He has a much softer look, a more open, awake, alert look. Things just look firmer, tighter, and even more glow to the skin, which is super. And here, if I didn't mention it, it is, again, approved for acne scar treatment. Acne scars more likely to require more than one treatment, and they're difficult to evaluate photographically, really, because you're trying to see a 3D deficit with an acne scar in a 2D photo. But I think, if you look, you do detect here improvement in the overall smoothness of the skin. And again, for something with no downtime, we don't have anything else that has no downtime and has the capability, basically, of treating acne scars as well as this. So let's get to some frequently asked questions. Number 1, of course, is it safe? The answer is absolutely yes. There have been no adverse events reported with Sofwave. It is not able to damage fat or nerve or blood vessels. It doesn't risk burning the skin because of that contact cooling that's built into the handpiece. And it's safe for all skin types, which is amazing, because darker skin types, we can get into trouble sometimes trying to treat with laser and even with radiofrequency microneedling, especially with heat. And Sofwave is safe for sun-exposed skin. So even if you have a tan or you're going to be in the sun, you can still get a Sofwave treatment done. Next question, what areas can be treated? Well, frankly, we can treat any area of the skin with this technology. I've given you the list of, technically approved areas, but having said that, if the skin is there and it doesn't have hair getting in the way of the ultrasound, contact, they can be treated. On the left, you see just with a makeup pencil, I like to mark out or grid out the area that I'm treating. It helps me keep my my overlapping pulses basically nicely lined up, but that's the only reason the marks are there. And the Sofwave has, as I may have mentioned, a smaller handpiece available. We actually have two handpieces for it, the regular size, and then the precision one, which is smaller and allows us to work in those small areas like the skin under the brow and also the skin above the lip. Certainly, although we're focusing right now on face and neck, the next area I see us using this on would be the center chest. A lot of women in particular, of course, have concerns about crepey skin or lines and wrinkles just above the breast. So I'm sure we'll go there next in terms of areas to treat. Now, if you start moving elsewhere on the body, it may not be the ideal treatment just because of the time constraints and lidocaine constraints in terms of the topical numbing. So I don't see us, using this on a whole leg or something like that. It would just be too time consuming. Next question, what's the preparation? And I'll marry to that, what's the pain level? Number one, you certainly want to arrive with a clean face and neck. No makeup in the treatment zone because that just really slows us down and we have to scrub it off. You'll sit with topical lidocaine on for 45 to 60 minutes. I personally like to do a little bit of injection lidocaine in some regions, like for numbing the forehead and around the eyes, because it just makes it so much easier to tolerate. And also, I can keep the energy level up at the maximum effective one. Now, compared to Ultherapy, we've certainly had quite a few people already who had Ultherapy in the past and have tried Sofwave already. And basically, their response is it's night and day. It's so much different and so much less painful than Ultherapy. So that's, just makes me very happy, actually. And finally, men, we do need you to closely shave any treatment zone. So if you have a beard or a mustache, we're not going to be able to treat over that. And just make sure you come in closely shaved so that we have the perfect contact with the handpiece on the skin. In terms of how long a treatment takes, again, there's that 1 hour of numbing time. Then we clean things off and we mark you and put the ultrasound gel on. And from there, the amount of time it takes depends basically on the anatomic size of the treatment zone and the number of passes we're doing. But for example, if we're doing a full face and neck and we're doing a full 4 passes, it can be 1.5 hours to 2 hours doing 4 passes. Now the minimum I would say is 2 passes. We're pretty much doing 4 passes for everyone because we want them to have the maximum result. If you're doing upper face only, and again, a full 4 passes, that could be a 45-minute treatment. In terms of downtime, as I mentioned, there really isn't any significant. Certainly in an area we're treating, we see some minor redness. Basically, that's just, within that hour. I'd certainly say the same day. For the most part, by the time people are checking out, the redness is almost all gone. There is minor puffiness. You don't really notice it much except perhaps around the eyes. I mean, that's the one area, because the skin, puffs or swells a little bit. Around the eyes tends to hold on to swelling a little bit longer than the rest of the face. But again, not anything you'd need to really plan around social engagements in terms of planning when to do your treatment. The next question, of course, we always get with collagen induction procedures is when will I see results? For any of these procedures, I talk about basically these 3 milestones: 3 weeks, 3 months, 6 months. The fact is, as soon as you create the injury, the repair mechanisms kick in immediately. But for there to be enough collagen produced that you see with the naked eye a change is happening, it takes about 3 weeks. At 3 months is generally when we will do comparison photos. And I generally say probably at 3 months, most people are seeing at least 80% of the result that they were going to get. Another 20% improvement maybe over the next 3 months. So when you get to the 6-month mark, we could do another photo and compare from before and after. But think in terms of those dates when you're planning your treatment, especially if you're getting ready for a special event, a wedding, a reunion, something like that. It would be great if you could do the procedure 6 months in advance so that you've seen your full result for whatever that special event is coming up. The other thing that will impact how long results will last, the next most common question is, how long will results last? Well, this depends on a number of factors. Number one, age. Remember I said when we're younger, we're losing collagen at a less rapid rate. As we get older, we're losing collagen more rapidly. So even though we've done this procedure, we have not stopped the aging process. Lifestyle certainly comes into play here. If you're using sunscreen and really good skincare, and if you don't smoke, then your results will be more prolonged compared to someone who, lives a different lifestyle. Generally, collagen lasts for years once we create it, but we're losing it every year as well. So perhaps a maintenance procedure could be considered in generally 1 to 3 years. So more like 1 year or 2 years if you're in an older age bracket, maybe 3 years if you're in your early 40s. So it's really going to depend on you, on your preference for maintaining your results, on your rate of aging, and on what you're using for skincare. And so, again, skincare, when we're talking medical grade skincare, we're talking things with retinol, with special peptides, with growth factors, and with antioxidants like vitamin C serum. So if you have questions about skincare, certainly field those with us. We can definitely take a look at what you're using and recommend what you can do to amp that up to further prolong your results. In terms of timing around other procedures, it's pretty simple. We would separate a heat-based treatment from Botox, so to speak, if they're in the same treatment region. So if you're getting a full face and neck treatment, for example, we're not going to do your Botox that day. The reason is that Botox is a purified protein, and if it is put into skin that is warm or hot, or if you heat skin that you just put Botox in, you're going to inactivate the protein, and it just won't work. In terms of dermal filler, it really depends on where the filler is and the depth that it's placed at. The Sofwave treatment is only impacting in that first 2 millimeters of skin. In most instances, dermal filler is deeper than that. The exception would be if you've got some filler in the upper layers of skin that was used to like blur out some fine lines, then a heat treatment directly over that may cause the filler to break down faster. And so questions about filler and Sofwave treatment, we're happy to assist you with that, and we'll review your record and go over where your filler is and advise you as to whether we think it will be affected by the treatment or not. And finally, PDO threads. For lifting threads, again, those are much deeper than the area that the Sofwave is treating. However, in general, we like not to be pressing on the face for about a month after thread lifting procedures. So that's what I would do, separate it out like that. Or if you have smoothing threads, smoothing PDO threads are thin hair-like threads that we sometimes insert right into that upper layer of skin to stimulate collagen. Smoothing threads generally dissolve over the course of 3 months, so you might want to wait 3 months after smoothing threads before doing a Sofwave treatment. So I hope that's answered most of the questions that might have come to mind. If not, we're happy to help you out. If you have further questions, please feel free to email us. The email would be info@renewmedispa.com. If you want us to review photos that we have on file for you and make a recommendation, again, you can do that. Just send us an email. And if you're a new client and you'd like me to take a look at your photos and make a recommendation, you can just email us some selfies. Again, info@renewmedispa.com, and we can take a look at those. In terms of pricing, you can see that through our app. It's renewmedispa.repeatmd.app. You might want to save that app to your home screen so that you can access it readily in the future. But if you go on there and you browse by concern and just put in wrinkles or jawline or neck, Sofwave is one of the treatments that will come up along with the pricing and a brief description of the treatment. However, you also might want to check our specials page, so renewmedispa.com/specials. You can always check there for promotions, promotional pricing, see what's being featured in any given month. And finally, you can certainly call us or drop by the medical spa on 23B Crystal Ave in Derry, New Hampshire.
Thank you again so much for watching, and we look forward to seeing you at Renew MediSpa.